Welcome back. It's been nearly 3 weeks since we rang in the new year, and many are still working on improving their health. Of course, that all starts with exercise and controlling what you eat. Of course, that's often easier said than done. Samaria Garrett, a registered dietitian and the founder of Feeding the Root Nutrition. Let's talk about the culture of comfort food. Samaria, glad to have you here on 3 at 3. Good to see you. We've been talking about doing this for the longest, and finally we are making it happen. But I do want to start with the new dietary guidelines. A lot of folks are going to have a lot of questions about this. How should we approach it?
Absolutely. So for those that don't know, the dietary guidelines are published by the American government every 5 years. Okay. And they are created based off of the science of nutrition, because nutrition is a science. And so every 5 years they put a committee together and they create new guidelines to inform the diets of Americans. And so this cycle will go from 2025 to 2023.
Well, help us take that deep dive into this new food pyramid that so many folks have been kind of wondering about. How does it look? What's in it? What do we need to pay really close attention to?
Absolutely. So this food pyramid, the image is a little bit confusing.
Right.
And that's why I think conversations like this are really important to have that expert insight. Because when we first look at that photo, we see meat and butter, and it can be a little bit confusing. And then we see those whole grains at the bottom. And for those of us that are grew up in the 90s, we saw the old food pyramid, right? And that showed that the smallest amount of things that we should eat are at the top, right? Which are those sweets. But at the bottom of this pyramid, where we see things in the smallest amount are the whole grains.
So what does that mean? Does it mean we can eat this unlimited amount of meats and
that's
fruit
what
and butter? Or
right,
what?
And that's what we're seeing in the headlines, but that's not the case, because the dietary guidelines in the report, it says that we want to keep your saturated fat less than 10%.
Okay.
So that means, for example, if we have a 2,000 calorie diet, you need less than 20 grams of saturated fat. So less than 20 grams of butter, the saturated fats that you find in meats and things like that. And so I am making the recommendation to don't eat less whole grains, eat more whole grains, because 90% of Americans are not eating enough fiber.
What about nutrients? Where should the focus be with that?
So the nutrients that many Americans are not eating enough of are dietary fiber. We find fiber in our fruits and vegetables and our whole grains. We also are not getting enough vitamin D, and so you find vitamin D in, of course, the sun, but also in dairy products and fortified foods. As well as potassium. Right. And we also need more calcium, which we also can find in dairy. So there's potassium, calcium, vitamin D, and a dietary protein.
Definitely some things to keep in mind. You had another picture that you wanted to share with our viewers here.
Yes, and so these are the dietary guidelines that we previously had.
Okay.
And so we are with the new dietary guidelines, we're switching to the pyramid. And so this is what we previously used, because the thought is we eat off of plates, not pyramids.
I got you covered.
Right. And so really what I've really been doing recently as I've been interpreting these dietary guidelines is taking the food from this pyramid and putting it on a plate, right? So people can really visualize what does this look like when I actually go to eat my meal.
That makes a lot of sense for sure. Heart Health Month is coming up in February. Where should our focus be there?
Absolutely. So really thinking, again, coming back to those primary nutrients that Americans are not eating enough of, dietary fiber is huge, because it really can help to slow down the absorption of cholesterol in our blood. So eating more fiber, so more plants. More plants. The image definitely got it right by putting those vegetables at the top, but those whole grains at the bottom, we still need more of those. So your oats and brown rice, quinoa, things like that, we wanted to have more of those whole grains, as well as potassium. So you find that potassium in root vegetables that can help counteract and work along with sodium to help lower blood pressure. And so when we think about Heart Health Month, the rates of cardiac illness in our country are skyrocketing, right? And so we want to encourage Americans to eat less of this added sugar and less of the added sodium and more of the potassium.
One last thing very quickly here. We talked a little bit earlier about the culture of comfort food. How should we approach that?
Yeah.
What can we eat? What can't we eat when it comes to food that a lot of us kind of lean towards?
So actually, these dietary guidelines, they talk a lot about decreasing ultra-processed foods, because the literature, the science is saying the intake of ultra-processed food is what is potentially leading to these chronic disease risk in America. So their whole push is eat more real food. But food is, like you said, is very comforting.
Yes, it is.
Right? And so I think moderation really is the key. Like, how can we find joy in eating while still nourishing our bodies? And I think that's where individually we each have to look at what are our values? What does our access look like? Right? What do we have access to at our grocery stores? What does our budget look like? Right? And how can we still have joy in our eating while still honoring our health?
Gotcha. Very quickly here, I know a lot of our viewers will want to know, is there a website of yours they can go to?
Yeah, they can visit my website at www.feedingtheroot.com. And so in my work, I work one-on-one with individuals, helping them lower their A1C, improve their cholesterol, and finding joy and comfort in food.
Feedingtheroot.com.
Feeding the
We'll
Root,
keep that in mind. Samaria, we got to have you back.